Hi there, my name is Cody McGee, student physical therapist. Today we're going to palpate some structures along the elbow. Is that okay?
Yeah, that sounds okay.
Great. So the first thing we're going to look at is your tricep here, which runs along the back of the humerus here, or the posterior side of the humerus, and then down the arm. So what I'm going to have you do is we're just going to feel along here, find that meaty flesh of the tricep, and then what I'm going to have you do is try and straighten your elbow. Yep, good. And I can feel the tricep engaging, and relax for me. Good. Perfect. Next, we're going to find our way down to the olecranon process here, and we're going to palpate, work our way down the arm here, along the ulnar shaft, and then we're going to come back up to the elbow, along back to the olecranon, find that divot, and then the structure following the side here. And that's your lateral condyle. Now from the lateral condyle, we're going to work our way down the extensor digitorum muscle, which is right in the middle here. If you were to extend your wrist into me here, go ahead. Yep, we can feel that muscle engage there and relax. Good. Now working our way down the arm, I'm going to work my way down the radius here to the radial spiral process there, and then over a little bit until I find what's called Lister's tubercle. Palpate there along that. Next, we're going to go along to the lunate. So if I were to flip that here and follow this, bend the wrist, and follow that drop off from Lister's tubercle, I can find the lunate. Next to that is going to be, I'm going to palpate over to the triquetrium. And then if I follow that along anteriorly, we'll flip him over here. On this side here, if I follow that around and find this structure here, that's the pisiform here. We're going to be looking at the brachial artery along the antecubital fossa. So what I'm going to have him do is I'm going to have you flex your biceps. So think about try and pull your fist towards you there. Yep, keep going. Good. And I'm going to palpate down towards the tendon and then relax. Good. Perfect. And then right along medially to that, we should be able to pick up on the brachial artery pulse there. And we don't want to use the thumb because it has your own pulse as well. Good, and I can feel his heartbeat there. Excellent. So then from there, we're going to go a little more medially until I find that medial epicondyle. And I'm going to follow this now to find his flexor digitorum superficialis. That runs all along here and then all the way down to his middle finger. So what I'm going to do now is I'm going to have you flatten out your hand for me. I'm going to take your middle finger there, just like that, and I'm going to have you think about curl your middle finger in towards me there, and while he's doing that, I can palpate along the wrist here, and I can feel that tendon engaging there. Looking at the first dorsal interossei, which if you palpate from the first digit here, I'm going to have him adduct, so I'm going to have him bring his finger towards his thumb, go ahead, and I can feel that engaging right there. Good, and relax for me. Excellent. And then lastly, what we're going to look at is the flexor pallusus longus. And what that is here is in his thumb. So if we hold this here, and I'm just going to have him bend his thumb towards me, go ahead. I can feel that tendon there. Yep. And relax. Good.